Today we're at the HIMSS conference 2014 with over 37,000 people attending. It's the largest healthcare show of its kind in the US, and we have our booth at CodeBaby in the 7900 row. Dennis McGuire, CEO of CodeBaby, was able to talk to some media, and here he is with Kathy Fowler of ABC News WJLA.
To help me and guide me through that and answer questions for me, similar to if you're talking to a customer service rep on the phone that's now online. And so we help guide and educate the consumer and the patients and allow them to take ownership and empower them to make the right decisions for themselves or their family.
So is it something that a customer signs on for? I mean, just any patient?
It can be deployed anywhere, literally on any online tool, whether it be a website, an enrollment portal, a hospital tablet application that might be a discharge application if I've been in for a hospital stay. So what we're really doing is creating these different engagements by the different form factors. So we have to address smartphone technology, tablets, or if you're at a desktop. So we really try and create that engagement strategy that again allows the consumer to go as far as they want on educating themselves and servicing their needs online. It allows the consumer to drill down on specific information as deep as they want to go. And often as humans, we don't like to show our lack of understanding or ignorance around a particular subject matter to another human. So as a nurse, I may not want to ask you more detailed information because it'll look, I feel insecure about that. Whereas with an interactive character, I know that it's an animation and I'm much more willing to ask more specific information. So once again, you're educating and empowering the consumer to follow their protocol when they leave the hospital at a much higher level. Yes, we have one of our solutions we refer to as Insight, is where customer experience is separate from the underlying technologies. So we're able to pull in data from multiple sources. So you almost think of it as a consumer dashboard, right? So I can look at my particular situation. So if you have an enrollment portal, you might want to pull in some of your health and wellness activities, maybe with some of your prescription histories, whatever information we can create it so that you have the consumer in one spot addressing all of the information they're most interested in. And they have the flexibility to add and delete what they see at any given time in that portal. So it does empower the consumer to see data that maybe isn't available all in one system because of the sheer size of some of these enterprises that are addressing the healthcare needs. So we're able to pull that data into one experience, which again empowers the consumer.
Hi everybody, I'm John DiDomenico. I'm here with Kate, and Kate's going to tell me all about CodeBaby. This is her first time at HIMSS 2014. She's so excited to be here. You can see how happy she is. There's been a lot of traffic at the booth. There's been a lot of interest. Big companies have stopped by to talk to Kate, and she's really filled them in on how fantastic, useful, and beneficial CodeBaby is. Isn't that right, Kate?